Tuesday. Happy new week. Hope this happened to the last video. We're in a new vibe now, in a new week. Meet him in the gym. We're not even going to take too long. We're just going to move on. I promise you guys the best set off camera. Catch me at the end of a set. It's just a nice little pool day. Didn't eat fat care. They're telling me to hurry up while I'm doing BIAYACAM. Guys. We're done, guys. Finished. That's alright. See you on the flip side, y'all. Boom. My tongue is starting to feel a little bit heavy.
Your tongue as well, yeah.
Yeah.
That's part of the axillary nerves.
Yeah. Like I'm biting on it just so
The
it
nice
doesn't
thing is
slip
your
back.
face is not changing. Like you're feeling it, but your face is not changing shape.
Yeah, I'm waiting for that part.
No, it's not gonna. It's not gonna. It's not gonna. It's not gonna. It's, you know, when we do the upper ones. That's when we do the upper ones. And then we have to like do filling and stuff, and we put the cotton wool in, whatever, and everything is like this for like 15 minutes while we're busy. And then when we take it out, then your face like it's sort of stuck in that way.
Like
but,
droop.
I think with the extraction.
So is the numbing more like a freezing thing that's happening?
So essentially, the anesthetic has two parts, right? It has the actual anesthetic, which is I say cocaine based, but it's an opioid based. It's
Nice.
lignocaine.
Thank you for my first time.
It's lignocaine, and then there's a bit of adrenaline in it, which constricts a blood vessel. So the adrenaline is applied locally, so that the blood vessel constricts, and it keeps anesthetic in the area. And so the nerves is all going. When you apply this anesthetic into the area of the nerve, it gets readily absorbed into the nerve and the bone tissues, and it just it paralyzes basically that entire, so you don't feel anything.
Is it possible to say I can feel the adrenaline?
Yeah, you could, yeah. Look, obviously it does get in a bit of muscle, so like a lot of times like a little bit of anxiety and stuff like that. And we have this new needles now, which costs an arm and a leg. So I've seen it now recently. They call it the wand. So it actually it's an electronic thing, no plunger, and the needle actually spins.
Wow.
And you actually, what you actually essentially do is you go basically like this. You actually drill into the tooth, into the bone, and you deposit the anesthetic right there. what happens is the patient's entire lip doesn't go numb. So the tooth the tooth is totally anesthetized, but it goes in this new thing. But it's so expensive, and there's such mixed reviews, the needle breaking, things like that. If you have patients with like super hard bone, then it doesn't work. So it's literally like pinpoint anesthetic. But for the most part, I would say majority of surgeries aren't using that way. Even if you're going like to a cosmetic surgery, even if you go to a maxillofacial surgeon, he's looking at you, he's like, no, dude. Maxillofacial surgeons don't even use this. They use like those 10 ml syringes, like these guys, and they put on like a needle, and they like mix their own anesthetic. So they'll use like they like draw it up out of these little vials, and they'll mix their own. So the surgeons still use the
old school
injection, old school. Yeah, look, 300 years of dentistry.
300 years, nice.
More or less 350 maybe.
Shout out the human race, man.
But nothing's, the needle hasn't changed, unfortunately.
Hey,
Here we go. Okay, so we're gonna test this tooth a little bit quickly.
we need to make, but then if it's make it a microchip, we now start taking people's religions.
Okay, I'm gonna you're just gonna feel pressure. Like I'm pressing your knee.
Okay.
That's what you should be feeling.
Okay.
You shouldn't be feeling any pain. We're just gonna test it out.
I shouldn't feel the tooth
You
sliding
shouldn't feel
out.
pain. So no, so you'll feel me press because the tooth is, remember, the tooth is in bone.
Okay.
But we're not pulling it, we're pushing down. We're expanding the socket of the bone, and we're getting a bit of movement. And then once that socket sort of ease up, and the ligament that holds the tooth in place actually it actually separates, and then we ease the tooth out more towards the cheek side. The tooth does have a big hole on the cheek side for you, so the gum over here, yeah, that you're not feeling, you can feel this. And yeah, you don't feel this. We might need to give you a bit extra here. Any pain there? Oh, this tooth is moving already with a probe.
No pain.
No pain. We're gonna move it slightly, and we'll see what it feels like. See if we might need to give you a bit extra. But you said you know, really bad interactions with the antibiotic. Everything was fine.
Yeah, everything was cool.
No real pain and discomfort now since.
No.
Yeah.
Antibiotic is cool. I do like
it's also because you haven't taken it, right? So
Yeah.
try to not take antibiotics. Like
Yeah, they told me next time they tell you that it was find something different.
but look, hopefully there won't be a next time. Like just try and stay off antibiotics
Yeah.
as far as you can. Like
Yeah.
because a lot of people that take a lot of antibiotics, often I have to like my uncle actually, he was here. I had to put him on 3 courses, and I had to find different stuff to actually give him, because the traditional amoxicillin flight will it's not effective anymore. He's got so much resistance. So here we go. A lot of pressure. And if you do feel a bit of pain, you just have to give a bit extra. This tooth is loose. How, bro? How do you have such a high pain threshold? We're gonna try and put some pressure now. Just breathe through the nose. Nose nice and slow, and just relax a little bit. It's gonna feel weird. I'm using the curvature of your tooth. Close a little bit for me. Now just relax that jaw, but there we go. Yeah, this is we can't ask for better than this. You see, now normally a big guy like yourself will hear the bone go. With this one, there's actually no sound. The tooth is virtually out. You should have videotaped this. Oh, you're videotaping? Yeah, just open your eyes. Smile for the camera. Yeah, this is so soft. This is best case scenario, bro. We can't ask for a better wisdom tooth extraction than that. Just gonna clean this up nicely. Nice little socket. It's out, bro. As soft as that. I'm gonna put a nice big piece of gauze in. That piece I'm gonna take out because that's just keeping the tongue away from me. So we don't want saliva to fill this wound. We want just the clotted blood to fill it. So we're just waiting for it to fill up nicely. I'm gonna give you the mirror in a second now so you can see what's up. But that is really best case scenario. Yeah, we cannot ask for. This was so you waited so long. Bite for me nicely. Bite for me nicely. There's actually no blood in your mouth.
Yeah.
You waited so long, like
That I kind of fixed myself.
that tooth wanted to, yeah, that tooth wanted to come out, and the shape of the root definitely, come have a look at. The shape of the root definitely helped us.
Wow.
See, and then that's where all the food's getting stuck. I don't want to get that out now. It's probably not going to smell too nice.
Oh no.
But
Oh no, yes. I can literally,
oh, that's where that funny taste in your mouth is coming from. You're like, what's up with that? Where's it coming from?
Oh
remember,
no,
this
so
is so far
sorry.
back. Ah, no, bro.
So sorry, tooth.
Soft. Softies. But this tooth, like, normally in a big guy like yourself, like I say, the infection was bad. I'm happy we wrote it out, but yeah, have a seat one more time. I want to show you something with a mirror quickly. What I expect from this cloth.
Oh man.
So when you look at it now later, you know exactly what you're looking for in your skins.
I'll take better care of you guys' teeth.
But that's best case scenario. No need for extra anesthetic.
Okay.
Just moved out nicely. That's what we wanted.
It was ready to leave. Oh no. Oh no.
Open up nicely.
I'm toothless.
Yeah, open up. So nice. No blood in your mouth, no way. And then what we want to do is, you can see there's a massive wound. You see that wound? It's about 3/4 of the way filled up. Yeah, it's about 3/4 of the way filled up. No cuts in the gum, nothing. Bite for me nicely. So that pressure, that's gonna fill up now nicely.
Yeah.
In the next hour, right?
Yeah.
And the clot, like with any wound, you cut yourself in the kitchen or whatever, preparing something, get a nice small little cut, pressure, bleeding stops, I'm gonna be fine.
Yeah.
Exactly the same. Wound healing is the same in every scenario.
Yeah.
The tricky thing, like I say, with this one specifically is wisdom tooth very close to the nerve.
Yeah.
If that same cut, you bump it and it starts bleeding and you'll be like, I'll be fine, just cut it again. With this one, if the clot fails to form, because the wisdom tooth is very close to the nerve, we don't want that wound too.
Yeah. Yeah.
So you have extra gauze here.
Okay.
You have that piece in there. It's a nice thick piece. I'm gonna give you some extra maybe.
Okay.
I don't think you'll need all of this.
Okay.
But that piece specifically, you keep it for an hour. You keep fighting like you are now. Just keep talking like a ventriloquist.
Yeah.
Fighting like a thief. And you'll be fine in an hour's time.
This is my pose, y'all. And I'm saying New Balance on the kicks. Saying White Millions, ex-Alex Beer and the Jaws. Saying Neon Blanc. Maybe saying some other band. And a Forge Cap. What are we saying there?
I can't keep up. Oh, sorry. Okay, sorry.